haven't seen him for a while, but he is here now. Dr. Mulholland, Canada's top cosmetic plastic surgeon. He is the owner of Spa Medica. Interesting story, because you and I were just talking. First of all, one of the things I wanted to ask you about is the difference between cosmetic surgery and plastic surgery, because there is a difference.
There is a difference. Plastic surgery comes from the Greek word plastikos, which means to mold and reshape. And so typical plastic surgeon will do reconstructive treatments from congenital defects like cleft lip palate to burn surgery to reconstructive breast surgery, post-traumatic facial injuries, and cancer reconstruction. And then one small part of molding and shaping is the treatment of age and under overdevelopment, and that is branched into cosmetic plastic surgery, so dealing with those things that are purely cosmetic. But there's a bit of a gray area. One does, like say, a facial injury from a motor vehicle accident that's left a scar and the nose slightly deviated, different from a cosmetic rhinoplasty where you're born with a nose that perhaps is a bit misshapen. So there's a bit of a blurred area. The general differentiation is if you're charging money for it and it's not covered by OHIP or your provincial care, it's cosmetic plastic surgery. If it is covered and it's functional or reconstructive, it is plastic surgery.
For the purpose of this program, I'm not, and we'll talk about what you do in your practice, but if people do have injuries or birth defects that they're questioning what they can do about, they can ask you about that. That you've dealt with that?
Absolutely. I was trained in both plastic surgery and ENT head neck oncology and cancer. So I did for the first 7 years of my practice facial trauma, complex cancers of the head and neck, tongue, and throat. And was trained in congenital and traumatic hand injuries, cleft lip palate, and burn surgery.
That's got to be night and day when you're talking about people. Is it fair to say people who have more of a need to get stuff done rather than a want?
Yeah, there's always that distinction, but at the end of the day, whether you're paying to have, let's say, a facelift done, or you are having a reconstructed basal cell cancer, all patients, reconstructive or cosmetic, want to look their best. They want things to heal. They expect their plastic surgeon to be on the top of their game and to take good care of them.
416-872-1010. You can text us at 71010 if you have any questions for Dr. Mulholland. You are at Spa Medica, which is Avenue Road, north of Bloor. And you were just talking about this. So you worked in hospitals for years until you opened your own practice.
I did. I worked for a number of years doing head and neck cancer, head and neck reconstruction, facial trauma. And then I invested in Spa Medica there on Avenue Road, and this is in December of this year will be my 20th year there. So I started in elementary school.
And you, yes, and you started out, I was asking you, did you have a client base? And you didn't.
I didn't. I really started from nothing. I was in Hamilton at the time, commuting there where there was a head neck oncology job because cancer's regionalized. So that's where a post was. That's where I took it, and I was commuting there. When I opened, I really had to start this new thing that doctors were allowed to do in 94, 95, which is market and advertise. So I took out some ads in Toronto Life and Fashion Magazine and radio and television. I was fortunate enough to get on a City Line as their plastic surgeon, and then breakfast television and e-talk and entertainment. Tonight, just talking about what was new and what was happening. And I don't think consumers and potential patients have been used to seeing a physician talk about what procedures they might do and what they might expect for recovery and the costs. And it sort of coincided with the evolution of Botox and fillers and iconic Hollywood characters and figures who were doing things. And that's when really cosmetic plastic surgery really took off, is in the mid to the late 90s.
Is that right?
Coincided with baby boomers turning 50 in a big way, too.
Oh, okay.
And so there was a demographic driver, there was new technologies, and we had new media outlets. And so it wasn't about getting a facelift anymore. It was how to look younger, fresher, more vibrant without surgery.
416-872-1010. Text us at 71010. Interesting, because we've never actually gone down this road before, but in chatting with Dr. Mulholland tonight and talking about the kind of work he used to do before the cosmetic work, which was the plastic surgery. You can call in if you've got a question about, a birth defect or a result of an accident, a scar, whether or not you would be able to get rid of that. And also any cosmetic procedures you've been thinking about having. We'll talk about how a lot of them are a lot less invasive now, a lot more common. Do they have something? I feel like I've read or heard something like the lunchtime facelift or these things you can get done in under an hour and people won't notice.
It's generally, if it says lunchtime lift or lunchtime recovery, I'd be a bit dubious, unless, of course, you take a prolonged 1-week lunch.
Okay.
Yeah.
All right, 416-872-1010. We've got Callie on the line. Welcome to the show.
Hi.
Hi.
I just have a question. It has been sort of gnawing at me a little bit. I have a 16-year-old, not quite 16-year-old son. He has, everything on his face is a little off center. I notice it as his mom. Like his smile is a little to one side. His nose definitely sort of veers off center, for lack of a better word. I don't know if it's because I'm his mom and I don't want him to be, I sort of feel it's my responsibility to take care of that now. If he needs to have a procedure, would you be telling me to wait till he was older? Or is that something I could go to a doctor now and they could... He also has a very nasal voice.
Yeah, there are many incompletely penetrant syndromes. What does that mean? There's always some asymmetries, and there are conditions called hemifacial microsomia, where one side of the face is a little smaller than the other side. The jaw is not quite as big. The cheekbone's not quite a bit as big. Generally, the nose will look a little off center. The smile, because the facial muscles aren't the same.
Crooked.
Yeah.
Yeah.
And so these are really quite common, and fully expressed. You get into real big, craniofacial abnormalities. But these subtle things, in general, are only noticed by the most detail-oriented individuals, like mothers,
like moms,
and sometimes obsessive-compulsive girlfriends. And so I always recommend waiting till the craniofacial anatomy, the bones of the face, have stopped growing for a guy that's about 18.
Okay.
And all women have two different eyes, two different shaped ears, and some guys just look a little off. As long as he's not psychologically off, he'll do just
boy.
fine. Yeah.
I think it's probably just because he's so handsome.
Yes.
It's just this one thing that looks like he got smashed in the face from one side a little bit, but not enough to make it.
Sounds like he has one of those hemifacial or unifacial asymmetries.
Can I just ask you quickly, would that extend to the rest of his body? I know this is going to sound strange,
it's usually just the face, although you can have whole sides, upper limbs, torsos, slightly different.
Okay, just quickly, because this is why it's in my mind, because he's missing things on one side of his body.
Okay.
Like he's missing a testicle on one side of his body, he's missing wisdom teeth on one side of his body. I know.
He definitely has then a hemisomic syndrome, which is one side of the body, and it can happen sometimes from positioning in utero or from with things called constriction bands. And so he does have something that was developmental, and fortunately, he still is an attractive young man. And
he's a very you would never know. It's just because I'm his mom and I want to do right by him.
Just don't tell any girlfriends about it, because they'll find out on their own. It sounds like.
Thanks for the call, Callie. That's really interesting. Anyway, we got to take a break, and we've got people on hold, so we're going to get to your calls just as soon as we come back. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at Spa Medica. Welcome back to the show. Great to have you along. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at Spa Medica. The website is
www.spamedica.com.
All right, nice and easy. And Dr. Mulholland can talk to you about anything regarding not only cosmetic procedures and cosmetic surgeries, but also reconstructive stuff or scar revision if you had an accident, anything along those lines, because he's spent many years doing both types of surgeries. 416-872-1010. Text us at 71010. Hi, Victor.
Hi, thank you for taking my call. My daughter has scars on both of the back of her arms. She had a bad accident when she was 3 years old and went through a window. She's perfectly fine, and she seems very okay with it, but I'm just wondering if there's any type of plastic surgery that would be able to hide the scars. On the one arm, she had 25 stitches. On the other arm, she had 20.
And how old is your daughter now?
She is 17.
17. So if the scars by this time, they're usually white and whiter than the surrounding skin, or they're still a little bit red. The texture's a little bit different. It's kind of a shiny white, not normal skin white.
Correct.
And so there are some new generations of lasers that are non-invasive, and with repeated treatment over a scar can blend in the texture and the color and make them look far less noticeable. That obviates the issue that she has to feel self-conscious about them. If she's happy in her scars and her scars are happy in her, it's just an interesting story to her friends. If she's bothered by them, then there are some new lasers, fractional lasers, different devices that will blend in white or take the red out of red scars.
Perfect. Thank you very much.
All right, Victor, thanks a lot for the call. And I don't think you addressed this. If they're raised, are there things you can do for that?
Yeah, so there's different kinds of scars. Raised scars, there are different lasers and devices that will flatten them. If they're white scars, we can blend in the white. If they're red or dark, we can take the color out. So people should really just Google scar enhancement, laser scar treatments, non-surgical scar improvements, Toronto, and up will come the centers that have specialized in different devices that do that, and everything starts with Google.
What about creams that advertise themselves as, making your scars invisible? Do they ever work?
Some, like Strivectin was a classic, and Strivectin did make stretch marks were a kind of a scar, from usually pregnancy or rapid growth, lighten a little bit. And there's some creams that bleach and lighten and take pigment out. But to make scars go away, your mother would always say put vitamin E on it. In general, no. That doesn't take it away. And generally, some type of laser, energy device, or scar revision is required.
416-872-1010. Text us at 71010. Hi, Zack.
Hi, Barb. I just had a question for Dr. Mulholland. I scheduled my first, I've never ever had a surgery before of any kind, but I scheduled a rhinoplasty in March, but I didn't really shop around for, I didn't go to a couple different doctors. I just found one, and I do really like him, and I feel like I have a good rapport with him, and I feel comfortable with him. I just wondered, should I go other places first, or if I'm comfortable with him, should I just go with it?
I'm a big fan of go with your gut instinct, and if you feel a level of comfort with a physician and surgeon, and they've listened to you, and you feel that they understand what you want to achieve, you've gone through your due diligence, you've gone online, you've gone on rating sites, you've checked out with the college, you've checked with a CMPA, maybe you have some friends that have had the surgery, and you might have done some computer imaging, and he's showing you perhaps what could be achieved and some before and afters. That's the kind of diligence that if you're comfortable with that, you don't need to see other doctors. It's not like you've met the right girl, you should date 2 others before you get married. And so I think if you found the right one, that's good. You found him on the first time. Most patients are advised to see, to see 2 or 3 others, get a good feel. Even if the others, you don't have the same gut feeling, it just lends credence and credibility to the relationship you have. But if you feel good and you're on the right path and you know the range of improvement you want to achieve, stick with them.
Now, one more quick question. Thank you for that, though. Is it normal to pay for your first consultation?
It's a good question.
That's a great question, actually.
I would say in the city, like most things in retail, this being retail medicine, you get what you pay for. And so the better the physician, the longer they've been in practice, the more likely there'll be some sort of commitment fee to a consultation to discourage no-shows and to really weed out individuals that might be, exploring rather than committing. For example, my first 5 years, I didn't charge a consult fee. Now I do. So it's very common for surgeons in their first 10 years of practice not to have a consultation fee. It's very unusual to have a reputation as a top-of-market rhinoplasty or facelift surgeon and not have a consult fee. But in general, that consult fee would be applied to anything that you spent in the business.
Yep, that's exactly what is happening. All right. That makes me feel a lot better.
Yeah, the better the surgeon, the more likely you're going to get a consult fee.
All right.
All right, Zach, thanks a lot for the call. So that's actually a good thing.
Yeah, it is a good thing.
That's more on the positive.
I think that the best surgeons are going to be able to command a good consult fee because they have a great reputation for a reason.
Yeah, and that's a great question, and I'm surprised it hasn't come up before because people should know what to expect. So there always is a consultation fee with Spa Medica anyway, but if they choose to go ahead, it gets applied.
Correct. It's applied against that surgery or even other procedures performed within the clinic if you decide not to because if you look at most retail businesses, plastic surgery be no different. Most surgeons, plastic surgeons, will report a 20 to 30% no-show rate. Patient calls, they talk about the procedure, they're scheduled, and between 20 and 30% decide not to show up on the day of.
On the day of?
Mm-hmm. Yeah. So because I charge a substantial consult fee and I give good value for that, my no-show rate's almost zero. But, if I'm willing to commit to a patient 45 minutes to an hour of my time, I expect the patient to show up. But if there's no money, there's no value, no show.
Right. Or at least call.
At least call. Yeah, but you can't go to the Four Seasons. You can't you can't schedule a treatment at a spa. You can't go to a restaurant without putting your credit card down. If you don't show up, they will charge it.
416-872-1010. Text us at 71010. Your questions continue with Dr. Stephen Mulholland, cosmetic plastic surgeon at Spa Medica. The website is spamedica.com. And we will continue when we come back. You're listening to In-Depth Radio, News Talk 1010. Welcome back to the show. Great to have you along. Dr. Stephen Mulholland is my guest, cosmetic plastic surgeon at Spa Medica. The website is spamedica.com. And he's taking your calls on really anything regarding cosmetic or plastic surgery. And you mentioned earlier, and I'm gonna just screw it up, but I'll just put it simply this way: cosmetic surgery is the kind of stuff that is people are doing for enhancement, improvement. Plastic surgery tends to be more on the reconstructive, the trauma. And you've done both.
I've done both.
Right now, you're devoted solely to cosmetic surgery, or does it kind of blend over?
There is a bit of a gray area. As I said, you could be born with something quite asymmetrical that looks quite dysfunctional, yet it's cosmetic and not covered. But typically, it's black and white. You've had a burn, you've had an injury, you've had a trauma, you've had a cancer, it needs reconstructed, so you feel that it's normal. I'm taking relatively normal people and trying to enhance upon what's already pretty good and making it pretty gooder.
Yes. 416-872-1010. Text us at 71010 if you have any questions. And you can always call in anonymously, too, if you have anything to ask regarding invasive and non-invasive procedures. But I did want to ask you, because I was explaining to the listeners earlier, I have a really difficult time watching broadcasters objectively, watching the news, when things like that. When you go out socially, can you leave the cosmetic surgeon behind, or are you always kind of scanning faces and sort of looking at symmetry and things like that?
Well, I look at everybody, and in the first 3 seconds, I can't help it. It's part of my DNA now. It's the top 10 things I would do if she asked me.
Really?
But I never say it, or I'd have no friends.
Right.
So I never actually come out and talk to anybody about anything they might do. Even if they talk to me socially, I tell them, look, I'll see something like when you're old enough, and clearly they are. We'll come in the office and we'll chat. But in a social environment, it's usually not the right place. There's other people around that may feel awkward or uncomfortable. And it seems a little self-promotional. So I usually just try to dissuade the conversation. But yeah, I look at everybody, and I just look at the things I would do if she asked me in a professional environment.
Well, that's interesting, because I wonder, too, in a social setting, because people know who you are, do they come up to you and say, how much, or what would you do, or...
Quite frequently, yes. They'll come up and ask, or if they're patients, they'll come up and chat and ask about their procedure. I try to, because everyone's protected by federal privacy laws, not acknowledge patients unless they come up and chat with me. So I'm not rude. I don't go out of my way to talk to people because that would violate their privacy. But people will come up and ask about price. They'll come up and, because of Real Housewives, ask my wife what she's done. And of course, she'll say nothing. I'm part Hawaiian, part Botox, part Restylane. And so, people don't seem to have much of a filter anymore, especially the young millennials.
Interesting.
Seem if you're on social media, they can get a cell phone photo of you for their Instagram at any moment.
416-872-1010. Text us at 71010. And I did mention earlier, Ann Kaplan Mulholland, the Real Housewife of Toronto, is married to Dr. Stephen Mulholland. She's been in with us as well. But yeah, I know you guys get a lot of attention out in public now. Hi, Linda. Welcome to the show.
Hi, Barb. Thank you. Okay, my question is, I have a bump on the top of my foot near the toe, and the toe's also painful. They say it's an advanced arthritis, and I need surgery done if I can handle it, and then I don't need to do the surgery, but otherwise I need surgery to, I guess, remove the bump, I guess.
Yeah, so if you have arthritis, that is it's a degenerative change in your joints, and the end of your finger joints often get those little knobby bumps, and the end of your toe joints can get them, and they're called osteophytes or bony growths that are caused by ongoing inflammation in the joint. And so, yeah, to remove them and sometimes to fuse the joint or offer joint procedures is done. But in general, you want to make sure that it's debilitating enough that the pain and risk of the surgery will be worth the recovery. If it's tolerable, you've tried anti-inflammatories, it's always best to try non-surgical techniques first.
What is the recovery like for something like that?
Yeah.
Removing the little bony bump with or without fusing the end of the toe is a good, depending how old you are and the condition of your other feet, it can be 4 to 6 weeks, same with your hands. And then, of course, you put more strain on the other toes, and sometimes they break down. And so I would say 4 to 6 weeks, you're going to be in a walking boot, and you got to be very careful not to bump your toes. So hammer toes, claw toes, that prominent first toe bend from stuffing your feet in high heels all those years.
Yeah.
These all require realignment and bony, and it's really a long recovery. It can be 4 to 6 weeks for a small bump. It can be 4 to 6 months if you get your hammer toes, claw toes, and your bunions fixed.
Can it be just go away on its own, like this bump on top of my foot?
No, unfortunately, it's been the product of many years of arthritic change. It'll only go away if you ignore it and wear a soft toe shoe.
I got it wrapped up right now, and it feels a lot better to wrap it up. I don't feel as achy.
Well, that's symptomatic control is the most important thing. And I have to say, high heels are just not good in the long term for one's feet. And having lived with a young lady who likes to wear high heels and the consequences of having high heels and foot surgery, man, those flip-flops are looking pretty good.
Yes, 416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at Spa Medica. Somebody writes in here, this one's interesting. When people get a facelift, you notice they often get a Joker upright-like smile that is very noticeable. Is that normal, or is that a bad facelift?
I would say it's completely unacceptable in this day and age, and that was the stigma of plastic surgery. You pull so tight to try and improve the smile lines, you'd have this sort of Heath Ledger Dark Knight 2 sort of scenario happening, and of course, completely unacceptable. Now with newer techniques of soft tissue fillers and lasers and energy-based tightening devices, we don't need to do too much to the T-zone, meaning the under eye through the inner part of the cheeks, the nose base, and the mouth. And we can do very natural things and not pull so tight. So the best facelifts now, you don't even know they've been done. Someone just looks rested, youthful, fresh, natural, and you find out later they've had some surgery. The best surgery is really not noticeable surgery anymore.
Now, what is the recovery like from that? Because I'm imagining, people, wouldn't they have scars behind their ears and all of that?
So we hide scars inside the ear and in the crease behind the ear. Well done. A patient can wear their hair up, wear their hair down. Nobody can tell. Bald guys can do it because it's really easily camouflaged within the ear. Extended incisions can sometimes go up into the hairline, but in general, you need a good 3 weeks off. And when you go back, you can blame it on the dentist. Always blame it on dentists because people don't like dentists for some reason. And you always have a bit of swelling. And then you look really quite good by 6 weeks. So if you're planning on a big event, your daughter's getting married, you have a reunion, you have a big event, give yourself 6 weeks between any mini lift, brow lift, cheek lift, neck lift, eyelid surgery, because it'll take 6 weeks till you feel you look better than before you had the surgery. And of course, you're going to see all these people in a social environment. You want them not to be whispering and talking. And so give yourself 6 weeks. The biggest mistake I think patients make and we doctors make is we underestimate the recovery. It takes a lot longer than you think to look completely normal, and it lasts a lot longer than you think. if it's done well. Usually you'll get a good 8 to 10 years out of a lift of the cheek, neck, or face.
416-872-1010. Text us at 71010. Maybe we'll talk the costs about some of those procedures when we come back. Dr. Stephen Mulholland is here. Welcome back to the show. Great to have you along. And we are in our final segment with Dr. Stephen Mulholland, cosmetic plastic surgeon at Spa Medica. 416-872-1010. You can text us at 71010 if you have any questions. And I was telling you, we have a lot of good questions on the text board. So I'm going to go through a bunch of them. Someone writes in, I have a scar on my wrist from a major surgery when I was 5 years old. I'm now 28 years old. Is there ever any way other than surgery to cover it up or change it in any way?
Yeah, that's sort of like, there we go. Awesome.
There we go.
Sort of like that previous question we had in caller. If white scars are white, we can use fractional lasers and fractional radiofrequency devices to make the scar less noticeable. If it's still red, we can use lasers to take the red out. And some that are raised, we can cut them out and make them look better. And so I would Google scar revision, scar enhancement, laser scar treatments, Toronto, find the best centers. And there's rarely a scar we can't improve.
And it's funny because maybe, I don't know if I'm unusual. I was quite the tomboy when I was little. I have a number of prominent scars, but they don't bother me.
Mm-hmm.
I guess it depends on where they are.
Yeah, I mean, if you have a scar on your face in the open and it's untoward, or it can be quite deforming. Some scars are quite inapparent and can be completely not really detracting from your appearance.
I missed the PS on this text message. It was a complete nerve and vein construction at the time of the surgery. Does that make a difference?
Yeah. So if you've cut a sensory nerve or a motor nerve, you don't have the same sensation, might not have the same movement. That's a more tricky scenario. So once a nerve's damaged, it's been repaired and you don't get full return, there's really not much else you can do. We can work on the skin scar, but the debility from the nerve that was injured and repaired and not fully functional, that's forever.
Someone writes in, I have really painful flat feet, starting to develop hard calluses. Would Botox work for this?
That's a great question. Over the years, I've had women, let's say, that wear high heels and they get plantar fasciitis, which is inflammation of the sole of your foot, tenderness under the balls of the feet. And I've used soft tissue fillers under the balls of the feet. I call it pillows for your feet. And for spasms of the plantar fasciitis, Botox right into the plantaris muscle can help with those spasms. So in selected circumstances, in individuals who haven't responded immediately to orthotics. So first go to, look at a foot specialist and see if orthotics will work in changing your shoe. But if you still have to wear high heels and you have plantar fasciitis and tender soles, sometimes Botox and fillers will help.
We were mentioning before the break, and I should get back to it, that we were going to talk about the cost of some of the procedures. So what is the one thing that you would recommend for people to get the most bang for their buck if they don't want to spend a ton, but they want to have a more youthful or just a better version of themselves?
I would divide it into affordable non-surgical treatments, and then there's no one quick thing that will be permanent. So you've got your neuromodulators, Botox, Dysport, Xeomin that relax muscles, soft tissue fillers that bring out volume, and they have to be repeated. Usually the fillers once a year, the Botox 2 to 3 times a year. But if you've got a lot of wrinkles, sun damage, and skin that's lax, energy-based devices, fractional lasers, tightening devices can be a one-time treatment that give you years of improvement. So that's usually your best bang for your buck. Not so much the injectable products, which are ongoing, but laser-based treatments that give you a one-time recovery requirement, but long-term improvement. For example, fine lines and wrinkles, smoker lines, barcodes. You can make those 80% better, have a 2-week recovery, and they're better for years.
I actually was looking at something recently that women, I think we all don't like the look where people look just too stretched out or too puffed out or too whatever. And the youthful appearance seems to come from the skin tone. Is that like I'm noticing that more and more?
For sure. I mean, I always tell all my facelift patients, and I do 150 facelifts a year, that the lift is far less important than the quality and attractiveness of the skin. And so all the things we do after a facelift, photofacials for color correction, taking the blood vessels away, getting the brown spots lightened, have the pores less noticeable, even color, texture, and tone is by far the most valuable thing as a plastic surgeon I ever bring to the terrain. So a lift is kind of important, a small amount of volume, but beautiful skin. It's hard to put a monetary value on beautiful skin. Even if you're a bit droopy and saggy, even bright luminescent skin is just very desirable.
Yeah, no, I've really noticed that. And somebody writes in, actually, I'm a white male, 56 years old, who has keratosis and age spots, skin tags around the eyes. How can this be corrected?
So these are the little scaly, bumpy things. Keratoses are either the big brown stuck-on things, or they can be an actinic sun damage keratosis, which are crusty lesions. And it just makes you look like, old and sun damaged with these little growths. And so seeing a good plastic surgeon or dermatologist with some radio frequency needle things called a hypercator and some lasers can freshen up keratoses, sun damage, brown spots, liver spots, age spots, broken capillaries, wide pores. Energy-based devices in the hands of a good plastic surgeon or dermatologist can make your skin look 20 years younger.
But then when people have that done, then is it like stay out of the sun for the rest of your life?
That's a misconception. I'm still a big fan of the sun. We live in Canada. We're starved for it. We need that 26 hours of sun we get every summer.
Yes.
This summer anyway. So I tell patients, you can go out and get a little more sun damage, and I'm here waiting with you, in September, October, come back and we can turn back the clock again. When I say sun, I'm assuming people aren't lying in the sun with baby oil and iodine and aluminum reflectors.
That's right.
And listening to the Cars' new album. And so that was another millennium. Now I'm talking about women wearing some sunblock. They go out and they feel the warmth of sun on their skin. That's okay. I don't worry about that at all.
How about someone writes in about the red veins? Let me find this one. 55, developed small red veins on my cheeks, a little on the side of my nose, covering it up with makeup and powder. What can be done about those?
That's a really easy fix, and it really takes away from the brilliance and youthfulness of your skin, and often the face is quite ruddy. It'll flush easily. It feels warm and uncomfortable. It gets sensitive to cosmetics. And so that kind of rosacea, red, ruddy complexion, or cupros, it's often caused, is really fixed with something called IPL, intense pulse light, or a photofacial. And so simply Google photofacial Toronto or blood vessels Toronto. There are lasers such as a pulse dye laser, the V-beam, the Synergy photofacial devices that after 4 or 5 treatments separated by 3 weeks, you can make 70 to 80% of all those vessels go away, and your skin will be much more luminescent even and not ruddy, red-toned anymore.
Stephen Mulholland, Dr. Stephen Mulholland, thank you so much for this.
Always fun. Thanks, Barb, to have
Great to see you.
back.
We'll see you again soon. He's a cosmetic plastic surgeon. The website is spamedica.com.